So this session this afternoon will focus on how personalized medicine, the advancements in genome sequencing and polygenic risk scoring are revolutionizing IVF success rates and embryo selection. Our discussion will also focus on the collaboration between IVF experts and clinical genomic experts and how we can look at the role of AI and big data on enhancing patient outcomes and overcoming key challenges. We're so honored to have you with us, Your Highness Shaikha Dr. Alia Al Qassimi. I'm going to come to you for the first question, if that's okay. So, Your Highness, as a leader in both medical and social development, how do you envision the integration of genomics into IVF treatments and improving the quality of life for patients, particularly in mitigating hereditary conditions and enhancing reproductive success rates?
Thank you for the question. I would like to start, Assalamu alaikum wa rahmatullahi wa barakatuh. I would like to start by thanking M42 for hosting us and for me to be representing Emirates Medical Association.
Just your mic, please.
And me representing Emirates Medical Association, whether as a General Secretary or as the President of the Emirates Obstetrics and Gynecology Society here. Wearing both hats as a profession and as a social development expert, it is very important to see how what we do in the medical field has its direct impact on the society. And as the country has have looked into fertility rates, encouraging marriages, encouraging having, as we heard lately, a lot of initiatives that would support childbearing mothers to actually take this seriously for the sake of the population. Now, integrating genomics into the IVF has definitely made transformational impact in improving the quality of life of the patient, herself and the family as it is, as there is a lot of emotional burden and physical stress that a woman can go through, whether pre, during, or even if, God forbid, in case of failure, the multiples. The direct impact of that, of course, is in reducing hereditary cases, such as cystic fibrosis, certain types of cancer, knowing that in the pre-implantation of the embryo would definitely, let's say, empower the couple to make informed decisions in how to take care of a healthy family and the well-being of the full family.
Thank you. Dr. Monika, I'm going to come to you next, if that's okay. With the rise of personalized medicine, how are advancements in IVF tailored to optimize the success rates for patients, particularly those with complex fertility issues? And how do you see the input of genomics shaping this further?
Thank you, Dr. Sumaya. So can I say Happy New Year? Still January. So what New Year means, new beginnings. And the most pertinent to it is the origin of a new life. And that is what we do in reproductive medicine, always striving to bring out the best, healthiest new life. Now, gone are the days where we used to give patients just, one-size-fit-all kind of protocols and treatments in IVF. So personalized medicine and now personalized reproductive medicine has totally transformed the approach as to how we look at the patient who comes in for any fertility treatments. What personalized IVF actually does is that we are going to collect the unique traits in every couple, may it be hormonal traits, could be genetic, could be biological, could be immunological. And now, of course, with the advent of so much of genomics, the various genetic traits that would then help us to chart out the best protocol and the best way to treat this patient in a very customized manner. So we are eventually paving the way for a more accurate, a more precision-based medicine, a more precision-based IVF pathway, so that we get better outcomes, we get the healthiest individuals. Now, personalized IVF has definitely improved outcomes. It has improved the involvement of patient in decision-making and better success rates. And of course, generating healthier embryos so that we can have more and more healthy population so as to reduce the burden on the nation's resources. So that is what personalized medicine is doing. And of course, genomics and IVF, which is personalized, is all intertwined. And we'll go deeper into how genomics is actually helping us to personalize it in a better way to improve the success rates, reduce complications, reduce the time that a patient takes to get pregnant, and less unnecessary interventions, so less cost, less emotional burden, less psychological stress, which is so important in any patient who is coming in to get to the goal of parenthood.
Thank you. I'm loving hearing that actually all of these advancements in medicine are actually being utilized to empower the patients in the decision-making and keeping them informed. So this is wonderful to hear. Dr. Azza, I'm coming to you next. Can you talk us through about the recent breakthroughs in whole genome sequencing and polygenic risk scoring? How are these revolutionizing the way that we approach embryo selection in IVF?
Thank you, Dr. Sumaya. I think it's a long road with a lot of stations. So it's not only one test that we can do. We can test the parent, we can test the embryo. And as you mentioned, there are two different types of genetic tests. We have what we call the monogenic diseases, where one gene causes one disease. We know this very well, and we can do it whether for the parent who would like to have IVF pregnancy, because this increases their chance to have a healthy baby, and that's right. It's a long process, the IVF pregnancy, and I think by the end of the day, we need or we want all healthy baby. So one of this is pre-IVF or preconception carrier screening for both parents. We have also the premarital genetic test, which is now a mandate for the whole UAE. We are receiving samples from everywhere. And I think this put a big impact on the IVF clinic because they are receiving more patients with this kind of results. And here we can do the preconception screening for monogenic disease. It's not only about screening the parents, but for example, we get recently a case with embryo arrest. We identify the gene which causes embryo arrest. So this patient who will have repeated cycle of stimulation to have oocyte might not have a good embryo to implant by the end of the day. So we need to direct her to another pathway rather than giving her stimulation to obtain embryo. Regarding the polygenic risk score, we didn't start yet for the polygenic risk score, but I think this is the next station because actually we are analyzing mainly monogenic diseases. Polygenic risk score is still under development, but I think it's very good to develop because we have a lot of cases of cleft lip and cleft palate, familial cases, and these will follow the polygenic risk score. So there is a lot of tests available in UAE. We don't have to send a sample abroad. In a very short time, we can have the result and then guide the couple.
So for those of us that don't know, tell us a little bit more about what is polygenic risk scoring. What does that score mean for a patient? What potential can we use it when we're counseling a patient?
Okay, the polygenic risk score, it is a score done from the association of certain changes in the DNA. These are not, this might not be a deletion or a mutation, but a certain change in the DNA which predispose the child to have a certain trait. The only tricky point with polygenic risk score that there is the system which we have to develop to identify this risk, and if it is above a certain limit, this makes the child or the embryo liable for this kind of abnormality like the cleft lip or cleft palate. The only tricky point with polygenic diseases that they are of reduced penetrance. Penetrance means that if the person have the change, he might or might not develop the disease. So for polygenic risk, there is always, or polygenic conditions, there is always reduced penetrance. So even if we identify this change, we are not sure if they will produce disease or not. This is why it is tricky a little bit. And now we focus mainly on the monogenic disease because they are highly penetrant. So we know if the mutation is present, it will cause the disease. But for polygenic, we are not sure of it. But I think this will be the next development available in the future, near future.
Thank you, Dr. Azia. And then that leads me to your next question, Your Highness. Considering your role as General Secretary of the EMA and President of the Emirates Obs and Gynae Society, how can UAE healthcare stakeholders collaborate to advance this innovation in IVF and genomics, ensuring that we can give equitable access to patients and ensure that we've got patient-centered care across the region?
That's a very good and very important question. I believe with what is already in place, Emirates Medical Association and the society, we play a very important role in first knowing of what is going on in the country and relating that to the practices. The second is ensuring that there are training programs for the young doctors, and not only young doctors, even for students who would like to pursue the career. The earlier they are involved with the researches and these revolutions that are happening, the higher that we have promising future pioneers, let's say, within the field. And I think we play a very important role in one being more of a bank for this information, knowing where to refer those who would like to know more information for what is happening, ensuring that the younger doctors are aware of what is there, and it would be amazing if they can have shadowing programs with the providers of this care within the country. And definitely public-private partnerships is a direction from the leadership of UAE. And we definitely at the Emirates Medical Association foster that and support it and actually apply it and believe in it, because together we can definitely go further in a shorter time.
Fantastic, thank you. It is always about this collaboration and putting together our united efforts. Monika, I'm coming to you. In the age of AI and big data, how do we combine reproductive endocrinology, which is your area of expertise, with genomic analytics to actually improve patient outcomes and reduce that trial and error approach in fertility treatments? I know Dr. Azza briefly touched upon it, but tell me a little bit more.
Yeah, so this term trial and error seems very tricky, but yes, the truth is that obviously, even if we put in all the advanced technologies, we use the best labs, we have the state-of-the-art technology available for embryo developments, we use the best protocols, the best medication, but despite that, there are so many variables that are there in IVF. For example, egg quality, sperm quality, embryo development, and then the limiting factor of implantation, which might not still happen with the best of embryos. And of course, adding to these is the complexity of lifestyle factors and so many, and of course, age. Now, keeping all these variables in mind, yes, we do not always achieve the best success rates in IVF, despite hoping to do so. Now, here comes, of course, the role of personalized reproductive medicine, where we are at each step, we're trying to personalize based on the unique traits of the couple. Of course, genomics has added a big factor to that personalization, where now we are diving deep into all kinds of information about the embryo through genetic testing. We used to do karyotypes, but now we are doing monogenic gene testing. We are doing structural rearrangement testing. So the different levels of genetic testing, and with the addition of the whole exome screening and the whole genome screening, we have great information to how to select embryos and how to do expanded carrier screening, so as to then find out if a patient needs pre-implantation genetic testing in IVF or not. Now, having a lot of this data, we still might have to go through various cycles for a couple to reach maybe the perfect protocol, or to know the best way to implant, or know the best day to implant, which is done by endometrial receptor assay. What artificial intelligence does is, which is almost like a revolution, it is basically human intelligence, which is now simulating human intelligence into machine learning and deep learning, so that we can analyze all that big data. And actually, when we put the patient traits into the system, we get the best protocol in the first cycle itself. That means we would know which drug is the best to use, what dose would be the best to use, We will also, there are systems of AI where we can find out what is the egg quality. Earlier, we used to only see egg morphologically. Now we can actually find out which egg has the highest potential to become a blastocyst, which is the strongest stage of the embryo. We can also do automated analysis, sperm analysis, and then we can obviously select the best embryo. Even there's a non-invasive genetic testing. Normally, typically what we do is we have to take a biopsy from the embryo. And there are doubts about the skills sometimes. Sometimes it's not available everywhere. The cost might be an issue, and expertise might be an issue. And genetic testing is not available everywhere. But artificial intelligence can actually do a non-invasive ploidy testing by which you can identify the best embryo that should go inside the womb. So it's basically data-driven insights that we're getting into protocol selections, into drug selection, and even the day of triggers, sometimes we can decide better with artificial intelligence data. It also gives us, of course, driving the whole thing into more personalized IVF, and then also giving us some data where we can predict the success, which can help us to counsel the patient as to what do we think, how many cycles she might need. And this is especially applicable in certain groups of patients. For example, having recurrent, for example, low reserve. Ovarian reserve is a very important factor in the success of IVF, and sometimes it may take a few cycles to actually get the best embryo. So an AI tool is able to tell us much better as to how many cycles she might need, how much time she might take. And also, we can reduce the time taken for her to actually get pregnant, because we're getting the best, whole treatment pathway in front of us to give her the best possible. And then, of course, genomic testing has added to a huge load of information, which we have to use very carefully, of course, with the ethics being applied, with all the challenges of it being a machine-generated data, with obviously some hidden biases. We have to be careful how we use it, but definitely it has the potential to be a revolution in reproductive medicine, because things can be more accurate, more objective, more reproducible. So the next time the patient comes, you're able to counsel her better how the protocol was chosen, why a particular incubator was used, or why a particular kind of culture media was used for her, and why this particular embryo was chosen to go into her womb. Having still the limiting factors of implantation, AI can thus drive us, it can empower us to do much better and to get healthier pregnancies maybe in a much shorter time, to avoid complications, to avoid cancellations of cycles, and to get to the goal much faster.
Thank you, Monika. Dr. Azza, I'll come to you before I end our session with Her Highness Shaikha Dr. Alia. Dr. Azza, so what are the key challenges, in your opinion, in applying these genomic insights to fertility treatment, and how do you foresee us overcoming these hurdles in the near future?
The main challenge is that the more we discover, the more we see that we still have a lot to discover yet. So I think we cannot diagnose each and everything. We need to deliver this message to the patient, to set up the expectation of the couple, because there is always, can be a de novo mutation can happen in the embryo. There might be some genetic anomalies that we are not able to analyze because we didn't discover yet the gene, or we didn't discover yet the causative agents. And also we have the methylation analysis, which is growing now, the RNA analysis, the analysis of big families who have a certain condition, which help us to discover new genes and discover new variants. So I think we have to set up the expectation of the couple, explain, as Dr. Monika mentioned, we need to explain for the couple before doing the genetic test that there are some limitation for this genetic test. We cannot discover each and everything in the analysis. It's mainly targeted to certain conditions that we know today, but maybe tomorrow we'll be able to do more for this couple.
Thank you. And Your Highness, Shaikha Dr. Alia, coming to you as President of the Emirates Medical Association, how do you in your role use innovation and leverage technology to achieve the vision of the Emirates Medical Association of ensuring that we are advancing healthcare excellence in the UAE?
As the General Secretary of the Emirates Medical Association Board, we work together with the other board members. We have the President of the Association here. who definitely supports the research and incorporating the latest technologies, whether it's artificial intelligence applied in genomics or all other specialties, and how we can even create pathways and maybe even create societies that will that are up to date and that let's say empower the presence and importance of the latest genomics and artificial intelligence applications throughout all procedures in gynae, even maybe I mean, and supporting research where maybe even things could be known at an earlier stage. I mean, you've spoken about the ovarian reserve, and we only highlight that once we see the patients seeking parenthood. But I think ovarian reserve need to be maybe evaluated as a baseline much earlier in life, and that will only be achieved with awareness programs led by the doctors themselves and supported by the other specialties within the healthcare field.
Thank you so much. What a fantastic way to end the discussion. First of all, thank you to our panelists. If we could have a big round of applause for them all, please. Thank you. And then we'll offer the floor to any questions.
Hi, thank you so much. My name is Sandhya. The question is slightly off topic, but I think closely related. Now, a typical candidate for IVF is maybe a patient with endometriosis. So I just wanted to understand to what extent do we know more about sort of monogenomic or polygenic risk scoring for somebody with endometriosis, and therefore to what extent or how successful their IVF endeavors can be. I target the question to, any of you. Thank you.
So endometriosis, most of the cases are polygenic, are not monogenic. However, we do recommend doing, first of all, the monogenic disease score or analysis. And if we don't find any mutations, there are some polygenic risk score which are available as well, which can determine if this patient has a certain risk for this endometriosis or not. But then it comes the role of the clinician who will decide what would be the best management of this patient according to this kind of risk, if she has any. I think Dr. Monika, if you can add more about the...
So yeah, I mean, endometriosis is one of those multifactorial or polygenic inheritance diseases like polycystic ovaries. That's another one. So there is now, of course, more insight into that there could be a genetic inheritance involved. We're still kind of debating as to whether it will be really useful for somebody to know that she could have a predisposition for endometriosis. Because in the end, the management may still be clinical based on her symptoms, because minimal to mild may not really need any treatment, and they might conceive without any IVF actually. So it's a little debatable, but then insights are important. Like for polygenic risk scoring, like all the diseases, it will be good to know much before so that the patient is aware, so that she's not lingering on till a late age to kind of get pregnant. So it does help, because some of the endometriosis patients might actually suffer from low reserve without really knowing it. And they would just come to the clinic and never even having maybe those typical symptoms of endometriosis, but they may actually have something inside in the pelvis which could be only diagnosed laparoscopically. So yes, insights are always important. Now is the time is to be aware and to prevent if possible. Endometriosis cannot be prevented, but you can deal with it much earlier and in a much better way, especially when fertility is involved. So definitely it's a good thing to know, and I think some tests are coming up. In fact, some rapid tests are coming up now which give us some insight into it. So I guess it's helpful, but then it has to be balanced with a good counseling, because every patient who's diagnosed or sort of given that paper saying that you have a predisposition may not be suffering from it, and she might just get unduly worried prematurely. So a good counseling has to be coupled with all these polygenic risk scoring tests.
Thank you. We have one more question from Dr. Fatma.
Thank you so much. The question is to you, Dr. Sumaya.
Oh, no.
As a medical director and CEO of the Nettle Emirat, but also Health Plus Fertility, how are you connecting the dots?
So, I mean, it's a very logical sequence. And I think running a women and children's hospital, it starts before that. So, taking charge of an IVF facility absolutely fits within that whole picture. It's very difficult to be offering comprehensive and holistic women's health care and completely excluding that really vital aspect of that section of society who are having difficulty in conceiving. So in line with our vision of delivering that holistic and comprehensive journey of women's health, this is how we feel that Health Plus IVF fits in with our entire concept of the women and children's cluster.
And are you extending this also as a partnership, for example, with our colleagues in the genomics, education and awareness, maybe with the Mother House, with the Emirate Medical Association? How are you again connecting the dots?
So we are absolutely connecting with our colleagues in the genomics facilities. So we have just got the facility license, I'm very happy to say, in Danat to have genetic counseling, which is a really vital service for our patients. We are the pilot hospital for the DOH for genetic newborn screening.
Congratulations.
So these are really big strides that we're taking because it's central to our vision to ensuring that we give that comprehensive care package to our patients. And absolutely, you know, central to all of this is education of our staff, of our patients, by linking in with these fantastic institutions. So, yes.
Thank you so much.
Thank you.